For all the talk and promises that politicians on both sides have made in regards to lowering healthcare costs, it's only President Trump who's actually tried to do anything about it. No, he's not trying to impose socialist price controls. Rather, he's pursuing a most favored nations policy. But here's where things get crazy. It's not the Republicans who are rallying around this plan, it's the Democrats. But before I reveal all of that, let's take a look at President Trump's announcement.
Administration will secure what we're calling most favored nations drug pricing. The principle is simple. Whatever the lowest price paid for a drug in other developed countries, that is the price that Americans will pay. And we're using the term other developed countries because there are some countries that need some additional help, and that's fine. I think that's very good. Some prescription drug and pharmaceutical prices will be reduced almost immediately by 50 to 80 to 90%. Big Pharma will either abide by this principle voluntarily or will use the power of the federal government to ensure that we are paying the same price as other countries. To accelerate these price restrictions and reductions, my administration will also cut out the middlemen. We're going to totally cut out the famous middlemen. Nobody knows who they are, middlemen. I've been hearing the term for 25 years, middlemen. I don't know who they are, but they're rich. That I can tell you. We're going to cut out the middlemen and facilitate the direct sale of drugs at the most favored nation price directly to the American citizen. So we're cutting out, Bobby, the middlemen. It's so important, right? You got to do that. They're worse than the drug companies. They don't even make a product, and they make a fortune.
Now, while all of this sounds great, the problem is that executive orders don't last forever. Best case scenario, they last for an entire administration. Then when the next administration comes in, the next president undoes it. So at most, we have 4 years with this, assuming that these pharmaceutical companies don't launch a lawsuit and have the EO overturned. So what's happening is Democrat Representative Ro Khanna now wants to codify this. He wants to turn this executive order into the law of the land. You would think that it would be Republicans rallying around this, right? Trying to codify it to help Americans save on healthcare costs. But nope, it's the Democrats. And look, even if Republicans have issues on this, which I'll get into later in the video, you would think that they would have tried to codify some of President Trump's other executive orders, for example, such as his EOs on the border or on immigration. But nope, the first attempt to codify anything Trump has done has come from a Democrat. Who would have thunk? Here's what Ro Khanna had to say.
Mr. Speaker, I rise today to introduce as legislation President Trump's executive order for the most favored nation status on drug pricing. My legislation will codify President Trump's executive order, which basically says that Americans should not pay more for drugs than people in other countries and other parts of the world. Right now, we're paying 2 to 3 times more for our drugs than people in other industrialized nations. Now, this executive order, codified by the legislation, will allow our cabinet secretaries to put pressure on Big Pharma and make sure that they are not price gouging, and will allow for the importation of cheaper drugs. So you ask, why do we need the legislation? Because the reality is that Big Pharma will sue for the executive order like they did in the previous Trump administration. And in the previous administration, they managed to kill the executive order. The only way we can stand up to Big Pharma is to codify in legislation what the president wants to do in an executive order. So here's the deal. If I can cross the aisle and support President Trump's executive order in legislation, every Republican should be willing to cross the aisle and support my legislation. It's a pretty simple test. Are we going to stand in this body with the $16 billion that Big Pharma spent on lobbying? Or are we going to stand with the American people? We will know that answer based on how many co-sponsors we get for my legislation that simply codifies Donald Trump's executive order.
Now, there are really 4 major issues I have with this entire proposal. Number one, a lot of people are going to say, Daniel, aren't you being hypocritical? Because Republicans and conservatives are known for wanting smaller government, wanting fewer regulations. And there are going to be some people who say, well, isn't this more regulation? Isn't this the government overstepping its bounds? For me, this is less about price controls and more about trade relationships. It's similar to the tariffs, right? And how President Trump's argument for the tariffs is, hey, if you can put tariffs on us, we can put tariffs on you. And I think that it's not like Trump is trying to regulate healthcare across state lines. Rather, what he's doing is making sure that we as a country are paying the same prices as other countries. Instead, the United States will no longer subsidize the healthcare and drug costs for other developed nations. Look, President Trump isn't trying to impose price controls. He's not trying to limit what these pharmaceutical companies can charge, because even under this EO, they could raise drug prices across the board. Nothing is stopping them from doing that. All this EO is doing is saying, hey, if you are determining the fair market rate for developed areas like Canada and the EU, then that's going to be the fair market rate for the United States. I think it's similar. Look, I have a very diverse audience, right? I think it would be similar to if we all went to a steakhouse and they charged us based on our ethnicities, right? If a Hispanic person went in and for a cut of steak, they got charged $40. And if I went in and as an Asian, they said, you're paying $90 for the exact same cut of steak. And then a black person goes in and they get charged $120. And then a white person goes in and they get charged the highest amount. They get charged 10 times the amount of the lowest. They get charged $400 for the exact same cut of steak. That's exactly what's happening with these drug prices, except instead of steak, it's drugs, and instead of ethnicity, it's nationality. I don't think there's much of a difference there. And if you go back and watch President Trump's announcement, he makes it very clear this is only for developed nations. And what I really like about that is it leaves open that developing nations can be charged lower prices. I think that shows the humanitarian side of him, trying to help people out and realizing that, hey, maybe some remote places can't afford to pay the fair market rate. And okay, maybe we'll subsidize it for them, but we're not going to subsidize it for other developed nations. The second issue here is that a lot of people are going to say, well, what about R&D costs? So R&D stands for research and development, but this doesn't negate any of the rules we already have in the law books. There's a time limit, right? Whenever a drug is produced, you can't release a generic drug onto the market, and that allows the developer to recoup those R&D costs. So this doesn't take away from that at all. Number three, my third issue is I want to make sure that there are no poison pills in this bill that Ro Khanna is introducing. If anyone's going to vote on it, and heck, if Republicans come on board and this turns into a bipartisan bill, I hope that they truly read the bill. They shouldn't do what they did with Obamacare, right? They shouldn't pass the bill to find out what's in the bill. They should actually do their due diligence. They should do their jobs. Let's make sure there are no poison pills in this. And last but not least, even if this isn't the long-term solution, I'm just happy that something is happening. And that's, you can say what you want about Trump. You might not like his style. You might not like some of his policies, but at least he's trying to address some of these issues that politicians on both sides have been talking about for years. Talk is easy, talk is cheap, action is a lot harder. And my personal hope is that good faith discussions and negotiations will yield the best result for all of us. But as always, all of that is just my analysis and commentary. Let me know what you think about Trump's EO. Do you like it? Do you not like it? I know obviously I have a lot of conservatives and traditional Republicans in my audience who favor smaller government and fewer regulations. So I'm not going to be surprised if there are a few people who don't like this, but I'm interested to hear all perspectives. So let me know your perspective and analysis down in the comments. In today's video, I would like to recognize Helga Shabalaba Ding Dong. It really rolls off the tongue with practice. Fluffy LaBelle Chatlane and Robert Stevens as today's members of the Governor's Club. These are people who have given super thanks or tips to the channel. Really appreciate it. Glad you enjoyed. For Robert, thanks for letting me know that you and your wife watch the videos. I'm so glad that you enjoy. That really made my day. Well, over on CNN, they had to admit the latest economic news, which is, yes, inflation is heading in the right direction. And you just know that someone in the control room, a CNN producer somewhere, is yanking their hair out and just crying salty tears.
Wallet. U.S. inflation slowing, I should say, to its lowest rate in more than 4 years. That, according to April's Consumer Price Index report. It's an unexpected and very welcome development that's defying economists' expectations amid President Trump's ongoing trade war. Let's go live right now to CNN business and politics correspondent Vanessa Yurkevich, who's watching all of this in New York. Vanessa, walk us through this morning's report. Where do things stand?
Encouraging signs, Wolf. Inflation continuing to move in the right direction, cooling on an annual basis to 2.3%.
I mean, Wolf Blitzer sort of mentioned it, but what's really crazy is that this is even in the midst of all the tariffs, right? The tariffs were supposed to send inflation sky high, the prices just through the roof, but instead it's cooling down, it's slowing, heading in the right direction. This is really defying all expectations. The New York Times wrote this headline yesterday: recession warnings are everywhere except in the data. Mainstream measures have been slow to detect the impact of tariffs and uncertainty, leaving economists to scour earnings call and private sector data sources. Again, this is coming from the side, this is coming from the party that told us to trust the science, trust the data. And now that the data is showing something they don't like, they're just looking for breadcrumbs to prove that a recession and a depression are right around the corner. But unfortunately for them, fortunately for the rest of us, it looks like President Trump is good for the economy yet again. Well, there is even more bad news for the Democrats, according to the New York Sun. A DNC panel votes to overturn party gadfly David Hogg's election as vice chair. He hasn't even been vice chair for half a year, and they've already voted to overturn that election result. Again, they're the party, they're the side of democracy, and they're undoing democracy before our very eyes. So that panel voted 13-2. 13 voted to negate that election. 3 people did abstain. So David Hogg right now is still the vice chair. All that vote did was vote to return this to the delegates. So the entire DNC has to vote again. And so we'll see. They basically overturned this on a technicality. But what's interesting is after all the research I did, and I did a lot of research, I spent at least 40 minutes trying to find what this technicality is, have not found it. Have no idea. Clearly, they just want to get rid of him because they don't like the results. Again, so much for democracy. Last but not least, tomorrow, Jake Tapper's new book comes out. I am so excited for it. Original Sin. And like I said, I will be reading the book and I will let y'all know any good tidbits inside of it. But we've already gotten a preview. One of the nuggets, one of the revelations is that Joe Biden was so frail that his advisors were already planning on getting him a wheelchair had he won re-election.
So the White House physician, Dr. Kevin O'Connor, was telling White House aides that President Biden's deterioration of his spine, the degeneration, was so significant that if he fell one more time, that he might have to be in a wheelchair and serve in a wheelchair for his second term. But everybody pushed off the notion that he use a wheelchair until after the election. This is all part of a larger whole where the Biden White House tried to hide the extent of his deterioration, both physical and cognitive, as much as possible. In fact, as we all know, we all saw, as his shuffling gait got worse and worse from 2003 to 2004, they started putting aides around him as he walked to Marine One, the helicopter, that was to kind of hide from public view how bad his gait was, how bad his walking was, his shuffling, and also in case he stumbled again to make sure somebody was there. And this is just of a piece of an overall campaign to try to conceal from the American people the extent to which the president was really struggling to do his job.
And don't forget, they tried to tell us he was sharp as a tack. Both Karine Jean-Pierre and Jen Psaki told us that they couldn't keep up with him. He was just so energetic that they struggled to keep up with him. I mean, I guess if he's in a wheelchair rolling down a hill, I'd struggle to keep up with that too, but I don't know what they're talking about. As always, though, all of that is just my analysis and commentary. That's what's going on in the world of politics from my point of view, and I would love to hear from you. Again, the question of the day: what do you think of Trump's executive order when it comes to healthcare prices, drug prices? Let me know down in the comments below. I know some people are going to love it. Some people are going to have more reservations because you just don't like the government intervention and the regulations of that sort, but I'm interested to see and hear from all perspectives. Sorry I've been away the last few days. I had a really bad allergy attack that started over the weekend. I could barely make, Monday was treacherous. No exaggeration, quite literally could not make it past a minute without just sneezing for hours. Could barely talk. You can sort of see dry lips, dry nose. I'm good now, but probably the worst allergy attack I've ever had, to be honest. And fortunately, my annual with my physician is next week, so I'm going to talk to him about maybe getting shots. We'll see, but everything's good, and I'm happy to be back now. Trust me, you would not have wanted me making videos unless you, I don't know, have a fetish for sneezes or something. no shame, but hey, good to see you all again. If you haven't already, please be sure to give me a thumbs up. I know it's a simple thing to ask for, but it really does help me reach more viewers like you in the algorithm. Be sure to smash that subscribe button and check out one of these videos.